I, Cameron Henniger, voluntarily give Maryville University permission to record my image and/or voice and grant Maryville University all rights to use this recording in any medium for educational or other purposes that support the mission of the university. I understand that the following information will be gathered by a Maryville University student as part of a course assignment. I give my express consent for this information gathered in physical assessment to be filmed and posted in the student's course shell for access by faculties and students at Maryville University. I further acknowledge that since the recording is for educational purposes only and the information is not meant to be diagnostic, therefore Maryville University, the faculty, staff, and students are not considered liable. The recording will be deleted by the student and any of the devices as soon as it has been reviewed and graded by the instructor.
Good evening, I'm Calvin Henniger. I'm a Maryville Nurse Practitioner student. This is my son, Cameron Henniger, who was born May 23rd, 2001. He is 23 years old. This is my musculoskeletal assessment video. I'm going to start off by assessing the temporal mandibular joint. I feel no swelling. Go ahead and open, close, close. Move your jaw forward. Good. I don't note any crepitus or clicking or popping sensations with palpation. If you could, go ahead and stand up for me. Next, I'm going to assess neck range of motion. So if you could look down like you're looking at the ground, just your head, thank you. And next, extend like you're looking at the ceiling. Good. Next, we're going to touch our left ear to our left shoulder. And right ear to right shoulder. Good. And then I'm going to now assess his shoulder joints. So I note with inspection, I don't see any swelling, redness, there's no warmth of touch, no masses noted. And while I'm here, I will palpate his spinous processes, which I palpate. I don't note any masses, any tenderness, Cameron? No tenderness. Go ahead and bend forward for me. Spine curvature is midline. Okay, stand up. Okay, turn around for me. Next, I'm going to do shoulder range of motion. So let's do flexion, arms forward and up over your head. Good. Next, extension, arms towards your back. Good. Next will be abduction, arms to your side and up over your head. Good. Any pain or anything with any of this? Okay. And then internal rotation, so hand at the small of your back. Good. And then external rotation, hand to the behind your head like you're brushing your hair. Okay, perfect. Now I'm going to check for spine range of motion. If you could, bend forward like you're touching your toes. Good. Now extend backwards, don't fall over. Good. And then bend towards your left. Oh, bend, yeah. Bend towards your right. Now rotate towards your left. Rotate towards your right. Good, good range of motion. Any pain or tenderness?
No.
Okay. So now we're going to check for our elbow range of motion. Go ahead and flex like you're picking up a set of weights. Good range of motion and good extension noted. Let's keep our hands at our there. And while we're here, let's check for rotator cuff injury. We're going to lift this one up over our head. And as I pull down on his scapula, any pain would be indicative of a potential rotator cuff injury. We'll keep these at our sides. And as I rotate in for the Hawkins test, that would be indicative of rotator cuff injury as well. So back to assessing the elbows, we'll keep them at our sides at a 90-degree angle. And as we supinate and pronate our hands, I'll come back over. Good. Now, while we're here, we'll assess finger range of motion. Keeping your hands flat, move your fingers towards the ground. Okay, now point them towards the ceiling. Good. Now spread them out like abduction and bring them back in. Perfect. Next, I'm going to do the Tinel test, which assesses for carpal tunnel. It's just by tapping over the medial nerve. Any tingling that promotes is a sign of potential carpal tunnel. Any tingling? Okay. And then we're going to do the Fallon test, found. We're just going to put our wrists together. Normally you would hold this position for a minute, but for the sake of time, we won't do that. But again, if any tingling occurs, that's a sign of potential carpal tunnel. So if you could, Cameron, I'm going to assess your gait now, so walk towards the windows. And with this, I'm just looking for smooth movements, symmetrical, no atrophy, and a nice smooth walking gait. And it looks good. So if you could now, we're going to extend or flex our knees. And extend it. Okay, good. Okay, go ahead and lay down face down. Flex this knee for me. We're going to just check hip rotation. Go ahead and lift this one up. Any pain or tenderness? Okay, good. Flip over for me. So we're going to check hip adduction. Go ahead and kick it out here. Good. Kick it out here. And then you come back to midline. Good. And now I'm going to check for external rotation. We're going to just bend this one up and over here. And any pain? Okay. And then external rotation. Any pain? Okay, good. Now I'm going to check for knee effusions. This is the Blotman test. Just placing my hand over here. If I feel with it under the patella, should feel like it's floating, unless like there's fluid under it, which I don't feel any with him. And then also I'm going to check for effusion by stroking the lateral side of his knee. Any potential fluid will move towards the medial, which I see none. I'm going to do the McMurray test. Go ahead and flex this one. With this, I'm just checking for meniscus injuries. Go like this. Just keep it straight. Okay. Then I'm also going to check for meniscus injuries by, and then the picture test, which will assess ACL. Any potential ACL injuries will result in excessive movement of the knee forward or backwards. And I don't note any of that. Okay, go ahead and sit up for me, Cameron. So I want you to swing your lower legs out to the sides and in. Good. And then I want you to flex your feet back towards the ceiling, point them forward towards the ground, rotate them in like pigeon-toed, and then rotate them out. Perfect. This completes my assessment. Thank you for your time.